Welcome back, registered nurse to be. Clinicals are coming up. Are you prepared? Keep watching to find out how prepared you really are for those nursing clinicals. What makes a student ready to learn in the clinical area? Researchers sent out surveys to hundreds of expert clinical educators in nursing and other healthcare specialties to answer this very question. As you prepare for your upcoming clinicals, whether it is your first or final, how prepared do you really feel? If it's not something that you gave much thought to, take this moment and think about it before you move on. Now that you've thought about it, are you scared out of your wits and uncertain, or are you ready to tackle clinical learning head on? The questions I'll ask you throughout this video will help you to gauge your readiness while highlighting those areas you need to work on to get ready. If you're ready to get ready with me for your nursing clinicals, let's go. You're preparing for your upcoming clinicals, but have you read or reread the theory related to the clinical practicum you're about to begin? Do you know the steps involved in the procedures you will likely carry out? Do you understand the institution's policies? Think of your practicum as an opportunity to put into practice all the things that you have learned in order to care for a patient. The general expectation is that if you're doing a practicum in year 2, you should be bringing with you those things that you would have learned up to that point. This might include microbiology, anatomy and physiology, physical assessment, ethics, and so on. As you prepare for your upcoming practicum, review the relevant content areas if you find that there is a deficit. For some of you, your practicum could be occurring at the same time you're learning the content related to the clinical placement. For others, the practicum happens after. In either case, you should understand those things that are common to the area you will be placed in. For example, if you are going to a medical surgical practicum, know the common conditions treated in that area and what common treatment interventions are used. Unlike in a classroom where it is easy to be a passive participant, for you to be successful in learning from your clinical experience, you will need to be actively involved in self-directed learning. To successfully do this, you will need to know your preferred learning style. Linked below is the Kolb's Learning Style Questionnaire, which can help you to figure out your learning style. During your preparation for clinicals and even after you have begun, information literacy skills are going to be essential for your success in the practicum. Information literacy means that you know how to locate information and how to evaluate it prior to using it as appropriate. The library and your librarian are useful resources for improving your information literacy skills. Last, but by certainly no means least, knowing how you'll be assessed, including the tools that will be used in that assessment, are information you will need as you prepare for the practicum. This information will help you to be able to prepare to meet these standards. For example, if you know that in the final assessment you'll be required to administer medications, in preparation for the practicum, you might want to refresh yourself on the medication rights and the nursing implications for the commonly used medications. Knowledge of the course assessment also includes knowing what the mid-semester assessment or coursework requirements are. Next question I want you to ask yourself is, are you willing? Are you willing to engage in learning activities? Are you willing to assist in patient care and other associated activities? And are you willing to learn and practice? Even as students, you are part of the healthcare team. As a member of the team, you have roles and responsibilities which make patient care possible. Because of this, your ability to work well with other team members is important to your success and the patient's success. If you have been described as difficult to get along with or hard to work with, this could be an indication that you may not be ready in this area. For some of us, receiving feedback from others can be difficult. As you prepare for your clinicals, reflect on those times when you have received feedback on something that you have done and ask yourself if you received the feedback well. If you did, great. Continue to be open to receiving feedback because the purpose of feedback is to help you to improve. If you did not receive the feedback well, think about why and make preparations to adjust how you respond to feedback. The ability to self-evaluate and the need to take responsibility for your own learning go hand in hand. Unlike the classroom, where the lecturer will plan learning activities and engaging activities, this happens to a lesser extent when you're on your clinical placements. If we are to measure a successful practicum by the number of new things you learn, the more successful student is the one who will be actively engaged in reflecting upon what they know and what they need to know, and use knowledge of their learning style to assist themselves to learn things that they do not already know. So, as you prepare for your practicum, how well or how often do you reflect on your knowledge level and your practice? How often do you take responsibility for learning into your own hands? One of the best things about your practicum will be the fact that you're able to practice all your skills while caring for your patients. These include communication skills, care planning skills, and hands-on skills. Students who are prepared for their practicum are willing to perform their skills as needed or as requested. Look back at all those skills you would have learned so far and the skills that you should be learning in the current semester. What would prevent you from being willing to do those skills? Is it a lack of knowledge of the procedure? Is it a lack of confidence in your ability to perform the procedure? Whatever it is, work on this area before your first day. Students who are prepared for their clinicals are willing to try new skills. My students often report to me that the nurses supervising them are asking them to do things that they were not taught in the skills lab. Think of it like this: the nurse is your teacher. Rather than shying away, let the nurse know that you haven't learned the skill in the skills lab just yet, but you are willing to watch while they do it, and you will do it the next time. That's a promise that you would have made to the nurse. So your responsibility after the nurse has shown you the skill would be to do some reading and practice on your own and jump at the next opportunity to show the nurse that you have learned the skill. Taking this approach will always keep you ahead of the curve. The next question I want you to answer is, what are the expectations for professionalism? What professional behaviors am I expected to demonstrate while on the practicum? Maintaining a professional practice means that you will be abiding by certain standards, such as a code of conduct and a code of ethics. Do you know what these things are? If not, use this opportunity before the practicum to get familiar with them. I know it's hard sometimes not to get attached to patients, especially those cute tiny babies. However, as professionals, these are some boundaries that you should not cross. For example, it would not be appropriate to share your social media information with a patient if you created it for personal use. How well do you navigate requests from patients to form a more personal relationship with you? Do you have a script prepared for these potentially uncomfortable situations? If not, I would suggest that you do. This is perhaps the area that students might spend the most of their time preparing for. If your practicum occurs after a major holiday where there might be a lot of eating and drinking, make sure that your uniform still fits in a way to maintain your modesty as you walk, bend, and stretch. Each society will have different standards on what is considered the professional look for a nurse. Know what it is and conform to it. You'd be surprised to know how much a patient's perception of your competence can change simply because of how well you fit into what society considers the professional nurse look. As a student, don't try to fight that battle in the name of how unfair it is that patients are judging you based on your looks. Because the truth is, if a patient thinks that you look incompetent, they will not allow you to practice with them, and that is your ultimate aim. The next question you should be asking is, can I communicate effectively with colleagues, patients, and their families? Effective communication means that the person with whom you're communicating interprets what you have said in the way that you intended. Are you an effective communicator? As a nursing student, you'll be communicating with patients from the very old to the very young. Your ability to choose the appropriate words is one factor which will affect how effectively you communicate. For example, an older patient may not understand what on fleek means in the same way that a patient may not understand what it means to be in a hypermetabolic state. If you are using words that the patient does not understand, communication will not be effective. Ask yourself, how good am I at explaining these healthcare things to my cousin who is not in healthcare? This could be a good measure of the effectiveness of your communication. Also, consider that when you are communicating with other healthcare professionals, the expectation is that you will use jargon. Do you know them? Are you familiar with them? Are you comfortable with using them? Disrespect and judgment are often communicated non-verbally. Facial expression and body language can be controlled with deliberate practice. If you find yourself in a moment of shock or disgust, quickly evaluate your facial expression and body language. Are they communicating how you feel, or are you able to remain neutral? I would have discussed professional communication with the healthcare team earlier, so I'll go straight into effective written communication. How well do you construct sentences which have the correct subject-verb agreement? Are you able to spell the words you are likely going to be required to use? Effective written communication, especially in the patient's chart, is important for maintaining professional and legal standards. So if this is an area for improvement, work on it as you prepare for the practicum. The next question relates to personal traits, so ask yourself if you possess the necessary personal attributes needed to engage in successful clinical learning. Are you attentive? Are you proactive? Are you curious? Are you polite? Do you have the desire to learn? Are you self-directed? These are a few of the personal attributes clinical educators agreed on when it came to determining a student's readiness for clinical learning. How many of these do you have? Are there any missing? Comment down below and let me know. The last question you should be asking is, do I possess the necessary skills? As you will soon find out, skills do not mean only those hands-on nursing skills. Challenges with time management and organization are two of the biggest challenges students relate about their clinical experience. These are perhaps the most important skills to have because without proper time management and organization, you will not be able to carry out the activities required to meet your objectives. In an upcoming video, I'll share with you how I map out my clinical day to make the most of every minute. While you wait for that, you can try strategies such as creating a to-do list for each shift. Even as students, you will be required to document in the patient's chart. To do this, it will require you to be able to apply the principles of documentation. You will also need to have a firm grasp of the English language, including rules for subject-verb agreement, punctuation, spelling, and so on. Each area will have certain skills that are routinely done but are not in other areas. Find them out and know them. For example, umbilical cord care and infant baths are done routinely on the postnatal ward. So if that is where you'll be placed, how prepared are you to do these things? Nurses need to have good observational skills in order to pick up on those subtle cues that could be communicating more than what the patient is saying. I find that students who are detail-oriented usually have good observation skills. If this does not sound like you, it does not mean that you will not do well. It just means that you will have to pay closer attention to develop this very important skill. How good are you at problem solving? If you are already good at it in your day-to-day life, great! Couple that with your knowledge of healthcare and nursing sciences to improve your clinical problem-solving skills. Now that we've gotten to the end of the video, are you still scared out of your wits and uncertain? Or are you ready to tackle clinical learning head-on? Leave a comment below and let me know how prepared you feel after watching this video. We've come to the end of another one, Registered Nurse to Be. Thanks for watching. If you liked this video, hit the like button and don't forget to subscribe to the channel for more awesome content. Share this video with other nursing students and follow us on Instagram at rn2b_876. See you in the next one.